Hey everybody, it's Dr. Trent Corey, physical therapist, and I just want to kind of go over a concept that a lot of folks, I think, have kind of an implication or an implied meaning when they talk to me, when they have a knee issue, and let's say they have maybe they're told they have a tear in their meniscus. Maybe they actually have an MRI that says they have a tear in their meniscus. And they kind of go with the tone of, well, eventually I'm just going to need to get surgery. And I just want to challenge that concept because I don't think it's exactly true that you definitely need to have the surgery done. There are parts in the meniscus, though, that are avascular. It just means there's no blood to it, kind of more towards the inner part of the meniscus, that if that part's torn, that might just be causing some mechanical blockage and it has like a clicking sensation, or your knee catches or locks. Sometimes then they need to take that little piece off, called a meniscectomy, and that will take care of getting that to move a little smoother. Now, however, when you do that, you're decreasing the cushioning of your joint, right? So, you know, that's supposed to be a shock absorber, and it does more than that. It's very fiber cartilage and lots of interesting, spongy type material, and it conforms to your femur as it lands on there and kind of creates a little rotation through there. And the less of meniscus you have left, the less that can cushion the blow. So that means that the part that's left has to take on more wear. Also, by just opening up the joint, you're creating oxidation in the joint, creates a decreased negative pressure inside the joint because it's like a hydraulic effect when you have that closed off. But when you open it to the atmosphere, that goes away. It causes a lot more problems and a lot more issues towards osteoarthritic changes. Now, that might mean eventually you might need a knee replacement. So that's possible, but then also I want you to pay attention to, there are many things that we don't consider in the traditional sense. A lot of folks don't think about, well, what if I did certain exercises a certain way? Or that won't really make sense because that's just working out muscle. How's that going to affect my joint? Well, I'm going to say to you that there are ways to balance out tension around the knee, in the front and the back and the side, and also create less pressure on there by doing therapeutic movement. And, a little while ago, I sent an article to my Outrun Knee Pain community saying that exercise through weight bearing in the right amount is therapeutic to the joint. And that's actually where a lot of people, when they stop running or they stop doing physical activity like moving, like walking and stair climbing or lunges and that kind of stuff, they actually might have more knee problems because that joint is not getting the nourishment it needs. So movement is medicine, right? So the more we can do that, the better we're going to create this environment. So our body's cells are able to take on that load and then get all those yucky products out and get all the good stuff in. And so it's important to just know what movements to do. And that's why a physical therapist is so crucial in this process. And it's not just about working through that painful knee. It's just also looking at how that whole body lines over that leg and how you line over when you walk and run. And also your total body alignment. What's going on in your spine and your SI joint. And if people aren't looking at this, or at least put you through a gross screen to see where the alignment issues are, you're going to still run into the problems. And, I was at the class, I teach a Chi running class, which is how to align yourself and move better. And I'm doing it in a running store. And the thing is, like, a lot of folks, they go to get the right shoes. They spend $140 on a pair of shoes that they think is going to be the thing that fixes it. It helps decrease some shock for sure. They also may buy a $50 pair of insoles. And then also they may get a $300 percussion instrument like a Hypervolt or a Theragun or something like that. And maybe they buy a knee strap. They do all these things, right? But they don't address the main thing, which is how the body's moving, how the tension is aligned over the joint. And if you're not paying attention to that, at least you're really not addressing the main cause. And I'm not saying that completely doing the certain exercises are going to completely alleviate your knee issues, but it's a good first start because you can get rid of all these other things. And if you don't have to go buy these crazy things, if they're necessary, they're necessary. But if you can get rid of a possibility of surgery and have your knee last a lot longer, that's going to be a more optimal way, in my opinion. So it's up to you and what you want to decide, and that's why I just give these videos. I always want to give you some good information about why I think of what I think, because I've had the perspective of being a PT for about 15, 16 years now. So hopefully this rings true in some way to you. I'd like to hear your comments below, because you know, it gives me some input of what you're thinking, and also stimulates a conversation of how I can help you the best. So I hope that gives you some good information. This is Dr. Trent Corey, physical therapist. Find yourself running, and go find my webinar at outrunkneepain.com. Take care.